So I want you to imagine waking up feeling more energized, your workouts feeling easier, your sleep deeper, and it's all because you've tapped into a little known peptide that tells your body, hey, let's crank up the youth hormone, but in a way that respects your own physiology. That's Sermorelin. Stick with me because by the end, you'll know exactly what the research says, who it can help, and how you might use it safely, effectively, and totally backed by science. All right, so let's talk big picture. Growth hormone, or GH, is like the body's internal repair and rebuild manager. In our youth, it surges during deep sleep, sparks muscle protein synthesis, supports bone remodeling, and even fine tunes our metabolism. But once we hit adulthood, GH production declines by roughly 14% per decade after age 20. By age 60, you're producing less than half of your peak GH levels, and that slowdown contributes to decreased muscle mass, thinner bones, slower recovery, and yes, changes in mood and energy. Direct injections of recombinant GH have been around since the late 1980s, and while effective, they're not without downsides. Costs often exceed $1,500 per month. They can blunt your own GH axis, and side effects like fluid retention, joint pain, and insulin resistance pop up regularly. And that's where Sermorelin enters the frame. So Sermorelin is a synthetic fragment of GHRH, growth hormone releasing hormone, comprised of its first 29 amino acids. So instead of flooding your bloodstream with GH, it whispers to your pituitary gland, hey, let's boost production. The result? A more physiologic, pulsatile release of GH that mimics youthful secretion patterns. Think of it as gently tapping your internal GH accelerator rather than flooring the gas pedal. And that nuance, more natural peaks and valleys, may reduce the risk of overtreatment. Today, we'll dig deep into how Sermorelin works, explore the key trials shaping our understanding, debunk common myths, and map out practical protocols so you can see if this peptide might fit into an evidence-based longevity plan. By the end, you'll have clear, actionable insights. No fluff, just science. So your hypothalamus secretes endogenous GHRH impulses, big surges approximately every 90 to 120 minutes, especially during deep slow-wave sleep. GHRH binds GHRH receptors on pituitary somatotroph cells, sparking GH release. Sermorelin is a synthesized peptide of those first 29 amino acids, enough to bind the receptor, but with a short half-life of around 10 to 20 minutes. That short burst fosters a natural episodic GH release. It effectively sidesteps two pitfalls. It doesn't linger to desensitize receptors, and it allows somatostatin, your body's GH off switch, to regulate feedback. And there's some key clinical trials. So what does the data show? First is the Corpas study. It was published in 1993 in the Journal of Clinical Endocrinology and Metabolism. In a randomized crossover trial, 10 healthy older men, the mean age was 68, received twice daily subcutaneous Sermorelin at 0.5 milligrams and 1 milligram for 2 weeks. 9 young protocols, mean age 26, were also studied. High-dose Sermorelin restored 24-hour GH and IGF profiles in older participants to levels statistically matching young controls, without exceeding normal physiological peaks. This demonstrated that age-related GH decline is at least partially reversible via GHRH analogs. Then there's also the Vitone study in 1997. This was published in Metabolism. So they gave 11 men aged 64 to 76 2 milligrams of nightly Sermorelin for 6 weeks. The average GH secretion over 12 hours doubled, and 2 muscle strength tests improved significantly. However, IGF levels didn't rise markedly, suggesting that dosing, timing, and frequency are critical levers for maximizing downstream IGF response. We also have the CRAM study, and this was in 1997, again in the Journal of Clinical Endocrinology and Metabolism. In a 5-month single-blind placebo-controlled trial of 19 adults aged 55 to 71, participants received placebo for 1 month, then nightly Sermorelin at 10 micrograms per kilogram for 4 months. The mean 12-hour GH secretion rose by over 50% at both 2 and 4 months, and serum IGF levels increased by week 4, peaking at week 12 before a mild decline at week 20. Subjects gained an average of 1.3 kilograms of lean mass and reported better insulin sensitivity, libido, and skin thickness. And lastly, the 2012 JAMA Neurology study. So they took 52 older adults with mild cognitive impairment. They gave them 20 weeks of nightly GHRH analog therapy, and they found it improved verbal memory, working memory, and executive function compared to placebo. So while this trial used full-length GHRH, it provides a compelling proof of concept for neuro-protective benefits of stimulating endogenous GH secretion. So what about safety and tolerability? So across dozens of studies, Sermorelin's adverse events were predominantly mild. Brief injection site redness, occasional headache, and transient flushing. Critically, no study reported significant fluid retention, carpal tunnel syndrome, or glucose dysregulation, side effects often seen with direct GH injections. And because Sermorelin works within your body's native feedback loops, engaging somatostatin and GHRH balance, it carries a lower risk of overtreatment and tachyphylaxis. So why does pulsatility matter? Natural GH release occurs in peaks and troughs. Continuous exposure can downregulate GH receptors and increase insulin resistance. Sermorelin's burst-like action mirrors physiologic patterns, so your tissues see GH intermittently, optimizing receptor sensitivity and minimizing metabolic downsides. So let's talk about some common myths and misconceptions. First, myth number one, Sermorelin is a magic fountain of youth. No single peptide or hormone can undo decades of lifestyle compromise. Sermorelin can restore GH secretion towards youthful ranges, but if you're sedentary, chronically sleep deprived, or eating ultra-processed foods, the clinical impact will be marginal. Think of it as one cog in a well-oiled longevity machine that includes exercise, nutrition, sleep, and stress management. Myth number two, higher IGF is always better. Most clinicians use IGF as a surrogate for GH activity, but IGF-1 is a double-edged sword. Observational data links chronically high IGF to certain malignancies like prostate and breast cancer. The goal is a mild, normal, age-appropriate IGF-1, not a sky-high number. Sermorelin protocols aim for the 50th to the 75th percentile, not the 95th. Myth number three, no medical oversight required. This is a big red flag. You need baseline labs, IGF-1, fasting glucose, and hemoglobin A1C, as well as a lipid panel, and periodic checks at 3 to 6 months. If you have a history of pituitary adenomas, cancer, or uncontrolled diabetes, you need specialist input. It's not a DIY supplement. And myth number four, Sermorelin blunts endogenous GH. Some worry that exogenous stimulation might shut down natural GH release. On the contrary, Sermorelin leverages your native axis and typically normalizes pulsatility. Discontinuation may return GH patterns to baseline, but that doesn't cause long-term suppression. So what are the typical dosing strategies? As far as a starting dose, it's 0.2 milligrams subcutaneously at bedtime, preferably 30 minutes before lights out on an empty stomach. As far as titration, after 3 months, check IGF-1. If below mid-normal range, consider increasing to 0.3 milligrams. If above 75th percentile, decrease to 0.1 to 0.15 milligrams. As far as frequency, daily dosing aligns best with circadian GH rhythm. Some protocols test twice daily split dosing, morning and night, to better mimic youthful pulses, but this adds complexity. And regarding monitoring and lab work, so again, baseline, IGF-1, fasting insulin glucose, hemoglobin A1C, lipid panel, and a thyroid panel. Around 3 months, you want to repeat your IGF-1 as well as fasting glucose. And around 6 months, a full metabolic panel, IGF-1, and patient-reported outcomes, sleep quality, energy, and mood. And regarding tracking clinical outcomes, with sleep, you should look for deeper slow-wave sleep, fewer awakenings, and subjectively refreshed mornings. Body composition, lean mass on DEXA or bioimpedance, plus circumference measurements. Strength and function, 1 rep max lifts, gait speed, and grip strength. And lastly, metabolic health, fasting insulin sensitivity, hemoglobin A1C, and lipid profiles. And to maximize results, you want to integrate. So first, resistance training, 2 to 4 sessions weekly, focusing on compound lifts. And protein intake, 1.2 to 1.6 grams per kilogram of lean body mass spread across meals. Sleep hygiene, cool, dark bedroom, no screens an hour before bed, consistent schedule. And lastly, stress management, meditation, breath work, or cold exposure for hormetic stress. Cost and access. So the peptide cost is approximately $300 to $600 per month for compounded Sermorelin. Lab fees, $150 to $250 per panel, depending on the provider. Clinical visits, this can vary widely, but some telemedicine clinics offer flat fee yearly subscriptions. And lastly, insurance, it rarely covers peptide therapy, so you need to budget accordingly. And what are the pitfalls and contradictions? One, you want to avoid active malignancy or pituitary tumor. Avoid, don't stimulate a potentially cancerous cell population. 2, uncontrolled diabetes. GH can worsen insulin resistance, so stabilize glycemia first. 3rd, pregnancy or pediatric use. Sermorelin isn't approved in these populations. And lastly, interactive medications. Glucocorticoids blunt GH release, so adjust dosing if you're on chronic steroids. So what are the final takeaways? Number 1, mechanism matters. Sermorelin leverages your own GHRH GH axis to restore youthful pulsatility, imitating natural biology. Number 2, it's evidence-based. Multiple randomized controlled trials since the early 90s show improved GH secretion, lean mass gains, and even cognitive benefits, without the overt side effects of direct GH injections. Number 3, set realistic goals. Aim for a mid-normal IGF-1 range, not superstar levels. You want to pair it with exercise, nutrition, and sleep optimization for meaningful outcomes. Number 4, monitor closely. Baseline and follow-up labs at 3 and 6 months are non-negotiable to ensure safety and efficacy. So there you have it, Sermorelin demystified. From bench research to practical protocols, It's not a silver bullet, but a well-researched tool in your anti-aging toolbox. If you decide to explore Sermorelin, do so under expert guidance. Track your progress diligently, and remember, the most potent longevity hacks still start with healthy lifestyle foundations. And as always, I thank you for tuning in, and I look forward to seeing you in the next one.